My previous role was from about, I think, 2008, I came back from America. I spent a few years studying in America, and I came to King's actually before KHP was founded. And when I was here, I was head of the Department of Experimental Immunobiology, running a number of programs in early phase translational research. And I also then led 3 5-year funding cycles of our NIHR Biomedical Research Centre. That first Biomedical Research Centre predated the formation of KHP and in many ways catalysed the development of King's Health Partners. So I have a long history. I've been away for the last 5.5 years looking at putting together an academic health science ecosystem in Greater Manchester with its devolved health and care budget, and it links in with the local council and with the ICB and the ICS. And essentially I came back 4 weeks ago to see how we could apply some of those learnings and some of that expertise across King's Health Partners. KHP in South East London has always been close to my heart. Even though I was brought up in Manchester, my mum comes from Dulwich and lived there. So actually King's College Hospital was my mum's and her family's local hospital. So I have long history with KHP. And actually I think on a more, if you like, prosaic level, I think King's Health Partners has all of the fundamental platforms to be a success in terms of an academic health science ecosystem. The problems we face of healthcare sustainability are global, but I really do think King's Health Partners, with all of its fantastic hospitals, universities, communities, more importantly the staff that work with us, have all of the components to solve probably the hardest problem that faces us today. These 3 pillars are really enabling platforms to deliver healthcare outcomes. We know that they link very well to the government's 3 missions. So just take the data platform. It's really important that we understand how we move from analogue to digital, to coin a phrase, but also really to use those insights to predict and prevent diseases. And I think doing that without understanding population health data, for example, is almost impossible. We know that it's impossible with the current workforce and funding that we have. So I think, if you like, the data and the population health platforms fit together very, very well. But actually everyone is an individual. So we talk about populations, and that's important. But actually every single person, every patient I see in clinic is an individual. They're not a population. So how do we ensure that our health and care system delivers what that person or patient needs in time, at the right time, and they get the right treatment tailored to them? So I think the 3 pillars, they're not separate, they all link together, and actually they enable us to deliver our mission of pioneering better health for all. I think now that we're 15 years into the partnership, our unique selling point is that we have a mature, respectful and trusted partnership, both locally and nationally. And I think it's hard to measure, and one always worries when things are hard to measure that they don't get recognised. But actually I think the depth of that partnership that's been forged in times of adversity and times of huge challenge is not insignificant, and I think that's what's going to hold us together clearly as we work through the next few years that won't be without its external challenge. I think that's in the general sense. I think in a specific sense, and we've spoken about this for many years, and it continues to be true now, but we really need to bear down on this, is how we treat mental and physical health with parity. Because you can't have physical health without mental health, and vice versa. And that really is the challenge of our time. How do we deliver that in a sustainable manner? We've seen post-COVID the almost epidemic rise in not just physical health, but mental health particularly. Also in our young people, our children and our young people. And so this is an enormously pressing healthcare issue that King's Health Partners is almost uniquely positioned to address. So I've spoken before about sustainability of healthcare systems, and clearly we need to be and are focused on the population of South London, South East London particularly. Over the past sort of 20 years, I've worked within and helped to formulate some strategies of academic health ecosystems around the world, whether that's been in America, in Manchester, or in some of the work I've done in sub-Saharan Africa. And all of these healthcare systems are faced by three enormous challenges. One, how do you continue to maintain excellence in healthcare? How do you do that in a way that allows appropriate and timely access across a broad population? And how do you do it in a way that's sustainable, not just in terms of finance, but in terms of people that work within the system? And those three things at the same time really is our Nobel Prize winning question. And I think putting a model together around partnership, and by partnership I mean our communities, our primary care sector, our social care sector, as well as our hospitals. How do we do that as a model, not just for South East London, for the world, is how we'll make enormous change across the whole of the world. My family, my three children, take up a lot of my time when I'm not in work. And sad to say, most of it's focused around football. So we have season tickets both at Fulham and also at Liverpool. So I'm have a split personality in that sense. As I said, half of my family are from London and half of my family are from the Northwest. So I do spend most of my diary planning outside of work is determining when either Liverpool or Fulham are playing at home, and making my travel plans accordingly. So I guess it's, football takes up a big part of my life because all of my kids have played football. Gosh, that's a very difficult question, hard to pick. I think just for its humour, because of course life gets very serious doing these types of jobs. I quite like comedy films, and I think the best comedy film was one of the early, what we now call mockumentaries, which is This Is Spinal Tap. It's a very old film, but actually it's a sort of a fly-on-the-wall documentary, and every time I go back and listen to it or listen to the soundtrack, it makes me smile. And I think any film that can do that 30 years after it was released is probably not a bad film.